Welcome, everybody. I'm Rebecca Eichenbaum. I'm a JOMA member and a child and adolescent and adult psychiatrist. Thank you, everyone, for being here tonight. I'm really excited to have this webinar and learn more about complementary medicine and how it could be used for anxiety and insomnia. And I'm really excited and honored to shortly introduce our speaker, who was a supervisor and mentor to me when I was in my training. But before we get into the content for tonight, as JOMA and as the Mental Health Committee, we just wanted to also take a minute to acknowledge the tragedy that many people probably heard about that occurred this week in Lakewood. And just to acknowledge that our thoughts are with the family and the community during this difficult time. And it could be hard to kind of talk about other mental health topics when this is looming large on people's minds. So we just wanted to take a minute to acknowledge that. Dr. Ariela Frieder is double board certified in adult psychiatry and consultation liaison psychiatry. She is originally from Argentina, where she trained as an OBGYN. Upon arriving to the US, she completed her residency in adult psychiatry and fellowship in consultation liaison psychiatry at Montefiore Medical Center, Albert Einstein College of Medicine in the Bronx. To broaden her knowledge and provide an integral treatment to her patients, she completed a fellowship in integrative medicine at the Andrew Weill Center for Integrative Medicine, University of Arizona. Dr. Frieder's expertise is in women's mental health. This includes emotional and psychological problems during the different stages of the woman's reproductive life cycle, such as pregnancy, postpartum, menopause, perinatal losses, and infertility. Dr. Frieder previously served as a Director of Psychiatry at LIJ Forest Hills Hospital and as the physician in charge of the Perinatal Program at Zucker Hillside Hospital in New York. Dr. Frieder has experience teaching and supervising residents, fellows, and medical students. Her passion is helping women of reproductive age and their partners deal with mental illness and emotional problems associated to this particular time of their lives. She has presented in numerous conferences and authored articles in reference to perinatal psychiatry. Currently, she has a private practice in Long Island. So, Ariela Frieder, Dr. Frieder, you could take it away.
Thank you for your introduction. I'm very happy to be here today. I was thinking about what you just said. Just want to say one thing is that in terms of the tragedy in Lakewood, like it's in my mind, and I'm sure it's in the mind of everyone here. And it makes me feel that I need to continue working on what I'm working. It really touches my heart and shows how important is the work we do in mental health and more for women.
Thank you so much, Dr. Frieder. I also just forgot to add in that we encourage anyone who has questions during the webinar to please post questions in the Q&A box, and they'll either be answered live or responded to directly in the Q&A box. The chat box is disabled, but the Q&A box is active.
Let me go back. Okay, so I think you did the introduction for me, so I don't need to, again, say everything. The only thing I want to say is that as I was working with women over the years, I started thinking about the fact that they were coming to me, asking me for something more. And I started feeling I needed to learn more in what they were asking me. And a lot of these women were asking about complementary and alternative medicine to help their treatment better. And that's when I started to be more interested in this field. And I went on to do the fellowship. So we'll start a little bit with the history of integrative medicine, just to get into anxiety and insomnia and how we treat it in integrative medicine. So really, integrative medicine has been around for ages, even from Aristotle, who was one of the first holistic physicians. He believed that every person was a combination of both physical and spiritual properties, with no separation between mind and body. Later, in the 1600s, Descartes did his best to separate the mind from the body, to protect the spirit from science. He believed that the mind and spirit should be the focus of the church at the time, and leaving science to dissect the physical body. In the 1700s, the reductionist movement shaped the way we think and treat our science and medical system now. The idea was that if we reduce the natural phenomena to greater simplicity, we could understand the larger whole. And in the early 20th century, medicine was transformed through the development of medical technologies, as you all know. And what prevails today is the triad of research, education, and clinical practice. And it's used the scientific model to better understand diseases and development of tools to help combat the influence of diseases. And all this movement led to the subspecialization. And so with your specialty, you become very good at what you do in a particular area, but a little bit was lost about how to treat chronic illnesses when more than one organ was involved. And medicine became more expensive, and managed care was created, and with all that, the patient-physician relationship started to get hurt. And that made that the public started asking for something more. And integrative medicine, really what it emphasizes is healing through the centrality of the patient-physician relationship. So it focuses in the least invasive, least toxic, and least costly methods to help facilitate health by integrating both allopathic and complementary therapies. And this is based, what is the most important thing for integrative medicine is the physical, emotional, psychological, and spiritual aspects of the individual. So the care is customized according to the patient needs and values, and the patient takes control, and the knowledge is shared with the patient, and it kind of flows really. And the decision-making is evidence-based, and there is cooperation between the team of doctors or other healthcare professionals that work with the patient. So the goal of integrative medicine is to facilitate health within complex systems, from the individual to the community and the environment in which we'll all live. So here you have how it really looks. So there is the person that is the center of the circle, and the integrative medicine physician will help the patient pay attention to their thoughts and patterns, and try to be very proactive about their self-care through the light circles that you see there. So working in their bodies, surroundings, personal development, the nutrition, the sleep, the community, the spirit and soul, and working on their mind. And once all that is done and there is more need of more treatment, is when the physician brings in either conventional treatments and complementary approaches. And the part where it says community, it emphasizes that while self-care is fundamentally of the individual, you are not alone when you do it. You have the community supporting you and helping you. So talking about that, we'll start talking about anxiety. And as you can imagine, there are multiple anxiety symptoms, and we have several diagnoses in what is the anxiety disorders. But here you see how it can manifest. And so anxiety disorders are some of the most common encountered medical conditions in primary care. And according to the National Institute of Mental Health, it is estimated that 19% of the adults in the US had an anxiety disorder in the past year. And it's more for females than for males. And it is estimated that 31% of adults in the US experience any anxiety disorder at some time in their lives. So, as I said, there are multiple symptoms that are part of the anxiety disorders. They usually interfere when it gets to a level that needs treatment. It's because it's interfering with your daily activities, such as job performance, schoolwork, and relationship. It's usually underdiagnosed, and many times when it's manifested with physical symptoms, it's confused with other disorders. And there are some patients that go around seeing doctors without having a diagnosis. It's very comorbid with other psychiatric disorders and medical illnesses. And the conventional treatment for anxiety symptoms is really antidepressants, SSRI, or first-line treatment, and CBT, cognitive behavioral therapy. And cognitive behavioral therapy, we'll talk more about it because it's used in integrative medicine, but it's basically a therapy that tries to change maladaptive patterns of thinking with a goal to change behavior and affect. And it's a combination of psychoeducation, relaxation techniques, cognitive restructuring, and behavioral changes in behavior. So when we talk about how to treat anxiety with the integrative model in mind, we have different levels. So the first level is to address diet, exercise, and mind-body techniques. The second level will be using supplements and herbal remedies. And the third level will be using conventional medications. One of the reasons why we use supplements and herbal remedies is because over the years, we noticed that conventional medications, they're effective, but they have a lot of side effects. And that was one of the reasons that I started looking into this, is because patients were complaining, SSRIs with the increased weight, with sexual side effects that are really interfering with their lives, were asking for something more. So that is one of the reasons. And supplements and herbal remedies, some of them, of the ones we use, usually don't have as much adverse effects. In terms of, I will just mention now mind-body techniques because we are not going to focus on that. I'll give you some examples of it. So one that we use a lot is mindfulness-based stress reduction. Is a form of mindfulness with cognitive therapy, and it combines also meditation and yoga. And it's an 8-week program that teaches you to cultivate self-awareness and increase your ability to deal with stress. And be non-reactive while you are aware of your experiences that you are having. The other type of mind-body technique is mindfulness-based cognitive therapy, that it also focuses in allowing distressing emotions, thoughts, and sensations to come and go without the need to suppress them, fight them, or escape them. So it combines cognitive therapy and mindfulness. One of the mind-body techniques it's very important to the topic today is CBTI, cognitive behavioral therapy for insomnia. It's very beneficial, it's very effective. It has no evidence of any adverse effects. And it's recommended as first-line treatment for adults with chronic insomnia. It improves sleep in 75 to 80% of insomnia patients and reduces or eliminates the need for sleeping pills in 90% of patients, which is really, really good. So let's start by talking about exercise. One second, let me see. Oh, okay, yes. So the current guidelines recommendations from the CDC is that we should do 150 minutes of moderate to vigorous physical activity every week. In the US, over half of all adults live very sedentary lives, and that is associated with an increase in mental health disorders, including anxiety. One of the important things that integrative medicine points out is that when exercise is prescribed by a physician, it's like you tell your patient, you kind of give a prescription for exercise. So patients take it in a very different way than if they are just hearing about in the general community. And how is exercise helping with anxiety? It changes central serotonergic systems and increases the production of endorphin. And there is a meta-analysis where doctors prescribe exercise as a therapeutic intervention, and it was found to be as effective as psychotherapy and almost as effective as antidepressants for anxiety. And numerous studies have shown that exercise is associated with reduced anxiety in clinical settings. And the thing is that with the studies we have, it's very difficult to compare and to have to understand very well how it works and what it does, because there are so many different kinds of exercises and there are different kinds of anxiety. So it's difficult to have an understanding of everything. But the evidence from 12 randomized controlled double-blind placebo suggested benefits of exercise for similar to established treatments and greater than placebo. So in terms of nutrition, very, very important is the diet. There is clear evidence that the standard American diet or the Western diet that is focused on eating processed meats, pizza, salty snacks, chocolate, sugar, sweets, soft drinks, French fries, beer, cake, ice cream is associated with an increase in anxiety. And we know that the Mediterranean diet or the anti-inflammatory diet, it helps with inflammation, and we'll talk more about that, and that helps with reduce of anxiety and depression. And it's basically based on plant-based foods, healthy fats, and moderate amounts of fish and poultry. Very important is to avoid alcohol, caffeine, and smoking, because it predisposes to the development of anxiety by producing chronic withdrawal symptoms, reducing health quality, and also precipitating somatic or emotional symptoms that maintain anxiety. Caffeine in particular acts on noradrenergic and dopaminergic pathways, and if it's used a lot, if it's overused, it can lead to anxiety and insomnia. And there is one study that suggests that actually that people with anxiety are more sensitive to the anxiogenic effects of caffeine. In terms of alcohol, it's used a lot as a self-medication. We see a lot in psychiatry, and the withdrawal from it can mimic anxiety. And the withdrawal from nicotine also can cause anxiety. In terms of fatty acids, there are epidemiological studies that show that omega-3 fatty acids deficiency are or an imbalance between the ratio between omega-6 fatty acids and omega-3 fatty acids is associated with increased anxiety and depression. The ratio that it will be good is 1:1 to 4:1 of omega-6 fatty acids to omega-3 fatty acids. And there is recommendations that suggest that the supplementation of omega-3 fatty acids is good for people with depression and anxiety. So there are different ways of supplementing it. The recommended, one of them is by consuming fish from cold water fish like sardines, mackerel, tuna, salmon, herring, at least 2 to 3 times a week, or flaxseed oil, or freshly ground flaxseed. It's important to know that the plant-based forms of omega-3 fatty acids contain alpha-linolenic acid, and that's metabolized into EPA and DHA in low amounts, like 10 to 15%. But the fish has naturally high amounts of EPA and DHA. So it's more beneficial to have fish than to use plant-based forms of omega-3 fatty acids. There is a meta-analysis of 19 randomized trial control studies and found that omega-3 supplementation was effective in treating depression. The average dose that they used was 1.4 grams combined of EPA and DHA. And there is a study that shows that supplementing SSRIs with omega-3 fatty acids shows a reduction of symptoms of depression better than just the SSRIs alone. So basically, the omega-3 fatty acids reduce inflammation, they lower cortisol, and improves heart rate variability. One important thing is that usually the onset of action, it takes 2 to 4 weeks, and you need to keep taking them. And it's very good, one good thing, because some people say that it's hard to tolerate the taste. So one good thing to do is to freeze the soft gels to improve tolerance. And then we have probiotics that are live microorganisms that have beneficial health effects on the host. And the gut microbiota is defined as microorganisms that live in the gut. So there are studies that suggest that anxiety increases the gut permeability, resulting in an inflammatory response. There is an animal study that shows that mice that were exposed to stress had increased circulating levels of cytokine interleukin 6. And this interleukin plays a central role in host defense. These studies have shown that higher levels of interleukin 6 and C-reactive protein led to the development of depressive symptoms. And moreover, that depression is an independent factor to increase inflammation. So as you can see, it's all interrelated. So stress can lead to a larger inflammatory response, which can also be linked to anxiety and depression. And stress increases the gut permeability and allow pathogens to reach the central nervous system. Also, inflammation can decrease levels of neurotransmitters such as serotonin and increase TRH and cortisol. In a literature review done in 2023, of the 9 clinical trials that treated patients with probiotics, 8 of the studies resulted in significant improvement of mood, as evidenced by decrease in anxiety and depression. So in terms of there are different kinds of probiotics. The ones that sometimes it's difficult to compare studies because they might use different ones. So they have multiple combinations, so it's very difficult to ascertain the effect of the individual strains. Ones that overlap a lot are lactobacillus and bifidobacterium. So further studies should check the efficacy of the individual strains and the impact on mood. So the probiotics that is recommended is 1 billion to 3 billion, and of Lactobacillus helveticus and Bifidobacterium longum. And the effect can be seen 2 to 4 weeks after, and you need to continue taking it. The other important thing about probiotics is that it improves HPA axis dysregulation, and it also stimulates the production of brain-derived neurotropic factor, and this influences neuron maturation, differentiation, survival, and proliferation. So all that is very helpful to reduce anxiety. The other thing that promotes the synthesis of brain-derived neurotropic factor is exercise. So aerobic exercise helps with the production of BDNF. In terms of supplements, anxiety can result from low levels of serotonin, norepinephrine, or GABA. There is, in the production of neurotransmitters, there are several cofactors that are important to the synthesis of these neurotransmitters. And these are magnesium, zinc, vitamin C, vitamin B6, iron, folate, vitamin B3, and copper. Sometimes assessing levels like of magnesium or zinc in blood is not accurate. A little bit more accurate is taking levels on red blood cells, but really what we do is watch the clinic and give supplementation because it's so beneficial. So in terms of magnesium, there are different kinds of magnesiums, and some of them can give GI symptoms, some of them can give constipation. The one that I like the most is magnesium glycinate because it doesn't affect the GI tract and it's well tolerated. And there are 2 ways of using it. You can use it for just for anxiety. You can also use it to help with sleep. And so you can take 125 to 300 milligrams per meal and at bedtime to benefit for the mood, or 200, 300 milligrams at bedtime to support sleep onset and duration. B6, vitamin B6, helps with the absorption of magnesium. So it's always helpful to give B6. And there are studies that suggest that magnesium helps antidepressant, lithium, benzodiazepines, and neuroleptics to work better. In B12, it's an essential cofactor for methionine synthesis and methylation reactions, and it supports mood, memory, energy, and cognitive function. For the absorption of vitamin B12, it's important to have the acid in the gastric cavity. And stress, trauma, or the use of PPIs and low zinc can impair the gastric acid production, and with that, impair the levels of B12. So normal levels supposedly are 200 to 1100, but 5 to 10% of people with values of 200 to 400 have neuropsych symptoms. So it's important to supplement B12 in those levels too. And the symptoms usually improve with the repletion of B12. Vitamin D, I don't think I wrote it here, but yeah, it's also a cofactor in the conversion of L-tryptophan to 5-hydroxytryptophan. And vitamin D is necessary for good serotonin levels. So if levels are lower than 30 nanogram by milliliter, it should be treated. And the goal should be levels more than 40 to 50. Usually you need to take it with fat. And a way of repleting it is to take 10,000 units a day of D3 for 2 months and then retest. In terms of 5-hydroxytryptophan, it easily crosses the blood-brain barrier, and it's used to synthesize serotonin. And we know that some people have a low amino acids due to stress, vegan diet, or antacid use. If you give 50 milligrams of 5-HTP, it helps, and you titrate it slowly. It can, in divided doses 2 to 3 times a day, it can help with anxiety. There is not much data, and I'm going to mention in some of these medications if there is any data in use in pregnancy. There is not much, and lactation, and there is not much data to use in pregnancy and lactation, so we don't recommend that. In terms of folate, there are genetic mutations in the MTHFR gene, and we know that it's associated with these mutations are common across many anxiety disorders. One thing to do is to use the active form of the folate, that is L-methylfolate, and that can improve. There are studies that show that it improves depression, and it can also, there are new studies that are starting to show that it can improve anxiety. The other supplement I wanted to mention is inositol. It acts as a second messenger in the serotonergic pathway, and studies for depression show benefits. Studies for anxiety goes both ways. Some show benefits, some not so much. But in one of the type of anxieties that they are seeing that it might be helpful is for OCD. And it can be used in pregnancy up to 4 grams a day. In terms of botanicals for anxiety, we have, here I have a list of some of them. There are so many, but I thought to mention some of them. There is N-acetylcysteine or NAC. It has anti-inflammatory properties. It's very helpful when you use it as an adjunct to OCD treatment to reduce severity of OCD symptoms. It's good for OCD, for nail biting, for trichotillomania, for addiction, and it can be used in pregnancy and lactation. It doesn't work rapidly. You need to take it for 3 to 4 months to see the response. The other botanical is GABA. It improves sleep and anxiety. It can be used combined with other botanicals, and this you can see that many of these botanicals can be combined. And so like there are some combinations with L-theanine. What it does is reduces anxiety, inducing relaxation, and the onset is immediate, and you take it when you need it. So you can supplement it for insomnia and for anxiety. There is one form that is branded that is called PharmaGABA that is supposed to cross well the brain-blood barrier, and so it gets to the CNS. It's better to take it in an empty stomach in the evening. In terms of L-theanine, it lowers stress, it improves sleep quality, it helps with sleep latency and daytime dysfunction, and reduces neuroexcitation because it inhibits L-glutamate receptors. One thing that you will see with these botanicals is that many that we use for anxiety, they are also very helpful also for sleep. It's shown to improve anxiety greater in people with baseline decline in cognitive function. And L-theanine is part of green tea, so it can be taken as green tea in pregnancy and lactation. One important thing is it can lower blood pressure, so you have to be careful with that and more in pregnancy. And it also increases alpha brainwave activity. And alpha wave activity is associated with improved concentration, creativity, and reduced anxiety. And there are randomized control studies that show the benefit for anxiety. The other botanical is ashwagandha. It's used in herbal medicine as an adaptogen to help the body cope with daily stress and supports healthy sleep. It stimulates GABA pathways to promote a calm mood. And it's very safe and tolerable. Needs to be administered for 4 to 8 weeks to see a response. It has better response than placebo in randomized trials. And they see that ashwagandha has an 88% response rate compared to placebo that had 50% rate response. And it comes, there is a brand that is called Sensoril, and it seems to be tolerated well. The other botanical is lavender. It reduces the HPA axis activation. It also helps for anxiety. There are clinical trials that demonstrate that more than 60% people respond, and with more than 50% reduction in anxiety. And what it seems to do, the active ingredient, is to shorten the sleep latency and increases duration of sleep. The problem with lavender, it can disrupt hormones, so like estrogen and testosterone. So you have to be very careful and not give it to pregnant women or to children that are growing, because there are cases of children with gynecomastia because of using lavenders. There is also another one that reduces stress and has an anxiolytic and sedative effect is magnolia bark, holy basil also. One that I wanted to mention is maca. Maca reduces anxiety and improves the libido also. And the effects are not hormonally mediated. So it's particularly good for menopausal women. So insomnia. So insomnia is the difficulty with initiating or maintaining sleep, and also having non-restorative sleep that is associated with excessive daily sleepiness or fatigue. So it often comorbid with other primary sleep disorders, with GERD, with chronic pain syndromes, and other psychiatric disorders. It's associated with significant impairment on life and increased risk of accidents and decreased work productivity. The thing to think about is that insomnia seems to be very resistant to conventional medical treatment, and it has been described as unremitting, disabling, costly, pervasive, and pernicious. The economic burden of insomnia in the US is estimated to be as high as $63 billion annually. And conventional sleep medicine has made advances in understanding and evaluating sleep, but there doesn't seem to be the same level of advances in treatment and prevention strategies. Many medications can interfere with sleep structure, also alcohol, software medications, antiarrhythmics, anticonvulsants, antihistaminics, appetite suppressants, benzodiazepines. Some of these medications are the medications we use for insomnia. So like tricyclics, sedatives can distort the sleep pattern. So in terms of how we approach it in integrative medicine, we approach it with a good nutrition, with exercise, with paying attention to your psychological well-being. We know that people that are more anxious, more stressed, have more difficulty sleeping, or people that are depressed. And when you think about it, you have into account the predisposing, the precipitating, and perpetuating factors like substance abuse, like predisposing factors like substance abuse, long-term use of stimulants, sedating, or medications that disrupt the circadian rhythm, illnesses that are associated with pain at night or discomfort, primary sleep disorders, like disorders like shift work, jet lag, and advanced or delayed sleep phase syndromes. It's very common that such stress is a precipitating factor. And as perpetuating factors, we see the behavior you use to manage or compensate the sleeplessness that actually inadvertently can exacerbate the condition. For example, like spending excessive waking time in bed, or napping, dozing, excessive use of caffeine, alcohol, and other drugs. So like spending a lot of time awake in bed to compensate for lost sleep results in conditioned insomnia. It's a negative association of bed with wakefulness that significantly perpetuates the problem. And we see this a lot. Like I see it with women more in pregnancy with the difficulty sleeping, that it gets to a point that they get very anxious about going to bed and going to sleep. When night comes, they become anxious about the possibility of not sleeping. One approach to insomnia is the noise reduction approach, and having in mind body, mind, and bed framework. So body talks about biomedical factors, the mind about psychological factors, and that's where you use CBTI. And bed talks about sleep environment factors, like making sure the temperature in the room is good, making sure that there's no light, having a comfortable bed. So all those things help with there's no noise, help with approaching insomnia. One of the things that this approach says is that we are predisposed to sleep. Our natural default is to sleep. And the noise reduction approach to insomnia is more concerned with the identification and management of factors that produce noise, like all those factors I mentioned. And so what you are trying to do is to decrease that noise. So in terms of botanicals and supplements for insomnia, in reality, with the exception of melatonin, which regulates circadian rhythm, both conventional and alternative sleep aids do really little to address the underlying wakefulness. But complementary and alternative medicine sleep aids provide less of a knockout and more of a gentle kind of assist to sleep, with significant fewer side effects than conventional sleep medications. But studies are mixed in regards to botanicals for insomnia. For example, valerian, it's a sedative anxiolytic, and it activates GABA receptors, but really you need to take it for at least 4 to 6 weeks to see a response, and studies are mixed in terms of it really helps or not. What helps to sleep is melatonin, and usually we see that in the stores they sell like 3 milligrams, 5 milligrams, 10 milligrams. You really need a lower dose, 0.3 to 0.5 milligrams taken 30 minutes before bed. Higher doses actually can disrupt sleep. Melatonin is synthesized from tryptophan, and it's via 5-HTP and serotonin, and the endogenous production is inhibited by light and stimulated by dim light and darkness, and it mediates sleep and dreaming. So one thing, when you take higher doses, you can have like a lot of awareness about your dreams. One important thing is that when you associate it with other medications, and cannabis and LSD can stimulate the synthesis of melatonin and can create a state of like waking dream. But melatonin, when you use it as exogen, it can help with sleep onset latency, the total sleep time, and sleep efficiency. It's important because the half-life is short. It's important that you use sustained release formulation. So I wanted to mention a little bit about THC and CBD. I have a lot of patients that come and they say, or either they are taking these substances, or they are asking if it makes sense to take it because there is a lot of talk about it helps for anxiety and insomnia, and they have been around for many years. The plant of Cannabis sativa has a lot of active components. The two most studied are THC and CBD. And THC seems to have more of a psychoactive effect. CBD seems to have less of a psychoactive effect, but CBD can potentiate the effect of THC. So my concern with this is that I was doing a literature search and I was looking for effects in the long run. What are the side effects, the adverse effects of CBD? And there's not much written really. And more because I work in reproductive psychiatry, I'm very concerned about the effects of this in pregnancy. And we know that marijuana can affect the placenta, that even using CBD, that it's not supposed to be psychoactive, but it can enhance the permeability of the placenta barrier to pharmacological agents and recreational substances, thus having the baby having more exposure to other agents. And it also can diminish the supply of oxygen and nutrients through the placenta. It's also not good for lactation because it's transferred into human breast milk and it's stored in the fetal brain, among other lipid filled tissue. So I was looking for, even for people that are not pregnant, what are the effects of this in the long term, you know? And it's really hard to find any studies that are well done because there are also different ways of administering the CBD and the THC, and not all the ways people take it are really comparable. And also the concentrations of the THC and CBD, because they are not regulated, we don't know what you are taking and we don't know what other substances are used in the mix to make it work better. So I just wanted to mention it because it comes a lot around and it's a real concern. Thank you.
Thank you so much, Dr. Frieder. I know it's almost 9 o'clock, but we got started a little bit late. And after that excellent and thorough presentation, we do have a few questions for you. One listener, stated, most patients with anxiety might get intimidated by a whole list. She used the words, will not go for a whole list. So which supplements would you say are most effective? Or another similar question, you know, of the list of things that were mentioned for anxiety, are there certain ones that you turn to first? Maybe we can start there.
Yeah, sure. So I use a lot of magnesium. I have a great response to magnesium. I find it very, very helpful. And it's so well tolerated when you take the glycinate, and not the other ones that affect the GI tract that patients usually ask, like they thank me after. What is important to tell them is that these substances, it's not immediate, the effect. So they need to keep taking it and taking it and taking it, and it will help. L-theanine is very helpful. Ashwagandha is very helpful. The thing is what population you are treating, you know, like if you are treating pregnant patients, I might go more with magnesium, you know, like I wouldn't try the other things that there is less reproductive safety data. But if you are treating women or men, you know, women that are not pregnant or lactating, you can use, I like a lot ashwagandha, works really well. L-theanine too. A lot of times you can combine them, and you can look, there are certain manufacturers that already combine them. So it might not be a lot for the patient because you already give them the medication combined.
So actually, as a follow-up to that, people were also wondering, you know, how to know where to buy these things, what are reputable places or brands, how to know that what you're getting is authentic. And I guess ideally it should be guided by somebody, you know, with expertise, but, you know, sometimes obviously it's not. And how do you know what to try?
Yeah, there is a consumer report that I usually check there. I need to look. The name left my mind, but I can send you and you can send it to people. It's like a website where they have like all the different brands and with what are the strengths, you know, in terms of like which one are really good and which ones are not so good or not well done. And so I usually go there and I look what are the better done.
Mm-hmm.
Because yes, there's no FDA regulation, like, you know, and you don't know what you're really buying.
When it comes to using the supplements that we talked about versus conventional pharmacologic, you know, medication treatments for, let's say, for anxiety or insomnia, you know, how would you assess who might be an appropriate candidate for these you know, supplements versus the conventional psychiatric type of medications? And maybe you could tell us a little bit about what goes in to an assessment of, you know, when you might opt for one of these by itself, or maybe sometimes together with other treatments.
Yeah, so it depends a lot on what kind of anxiety disorder it's. Like there is evidence that for OCD, it doesn't work alone, these supplements, you know, like you really need an SSRI or an antidepressant, and you can use them along that. In terms of other anxiety disorders, you can, it depends on the severity of the disease, really, and the patient's preferences. What is that they want, you know? Like, do they want just something kind of complementary or alternative, or they want something conventional? I always tell them what I think, you know, if somebody is severely anxious, I will not start them just on magnesium, you know, or on omega-3 fatty acids, you know. I might tell them, you know, you can take this, but this goes along with the SSRI because there is better data about the SSRI in terms of helping. So it depends on the severity of the disease, I would say.
Mm-hmm. That makes sense. Okay. Are there any supplements that you mentioned that should not be used together, or that should not be used with other treatments that that people might be taking or using, or standard over-the-counter medicines that people might be taking, without a doctor's supervision, that they should, avoid if they end up taking one of these supplements?
Yeah, so everything that has to do with serotonin, you need to be careful with like SSRIs, SNRIs, tramadol, like you want to make sure you are not creating a situation where there can be like serotonin syndrome. So you have to be careful in that sense with like a 5-HTP, there is SAMI that we didn't talk today. You have to be careful, St. John's wort.
Definitely. I think that's it for now. If anyone has any last questions, feel free to just type it in. Otherwise, we can wrap up and finish up the webinar for tonight. Okay. Nothing else popped in, so it's 9:05, so we'll let everyone out relatively on time. But we really appreciate everyone who joined. Everyone who was here stayed around, and we really learned a lot. So I certainly appreciate it so much.